So good afternoon, everyone. I'm honored to be a part of this webinar, and I thank both Pancreatic Cancer Europe and the European Oncology Nursing Society for the invitation. So today I'll be sharing with you some insight on how we can practically integrate physical activity into the care of pancreatic cancer patients with a focus on both advanced and localized disease. So here my disclosure. So the first step before prescribing physical activity program is a comprehensive assessment. So this includes body composition, often through with bioelectrical impedance, DEXA scan or CT scan at the L3 level to evaluate muscle mass. It's true that some machines are hard to find in current practice, like DEXA or the impedancemetry, but all our patients have a CT scan for cancer monitoring, so we can use it to make the muscle tissue assessment and the follow-up. After we have we also assess muscle function through tests like the hand grip, sit stand, the 6-minute walking test, or the get up and go test. And these tests can be made by physical activity professor, physiotherapists, but also by other healthcare professional form to do the test as nurse. And we found now the guidelines of with all the cutoff of these tests to evaluate muscular function and sarcopenia for our patients. Finally, we have to consider global factors as comorbidities, symptoms, motivation, and socioeconomic factors. We need to understand each patient's lifestyle and what barrier they might face to tailor a safe and effective program. Also, we have to understand patient motivation to assess facilitator element to physical activity and socioeconomic setting, because practice facilities are not the same between patients. For example, it will not be the same for a young patient in working age with children or an elderly retired patient. So now we assess all our patient physical condition, we pass to the practical implementation. We know that we are guided by a strong recommendation from the SMO, the ASCO, and the SPEN. And all of these societies support integrate physical activity into cancer care as early as possible. Is at the same time as the oncological pathway, all the societies recommends to evaluate nutritional and metabolic pathway periodically and make the intervention adapt to the patient condition and adapt to the different assessment. In the case of advanced pancreatic cancer, the medical treatment is based on chemotherapy. In this case, the APACAP study conducted by Professor Nozier and based on physical activity session in addition of usual care shows that this kind of intervention improves global health status and quality of life, especially functioning score and relief from symptoms such as pain, insomnia, appetite loss, and constipation. So programs in this case should aim to reduce sedentarity, as Professor Nozier said. So we aim to reduce sedentary times. We have to target a moderate intensity. We must adapt it to chemotherapy-induced fatigue and involve caregivers to promote long-term engagement. In localized pancreatic cancer, where surgery is the keystone of the treatment combined with chemotherapy, rehabilitation must be the best intervention we can offer for patients. Rehabilitation is a multimodal pathway to combine physical activity, nutritional, and psychological support. For pancreatic cancer patients, studies show that this kind of structured physical activity improves treatment tolerance, clinical outcomes, and physical function. But data in this localization is limited because in this study we can observe an important rate of patients who decline participation due to the psychical impact of the illness, or they are not interested. So we can answer ourselves about general knowledge about the positive impacts of physical activity intervention for this patient, but also we have to take account of all the difficulties who the patient can be confront in his life. So to summarize, for localized patient, the main objective is to enhance patient physical condition, to improve treatment tolerance and outcomes. And sessions can range from moderate to intense intensity, and this will be carried out over a shorter and target period. So physical activity cannot be considered isolated, as Professor Nazier said earlier. Nutritional support is critical, and it's important to help patients to achieve the goal of 30 kilocalories per kilo per day and 1.5 grams of protein per kilo per day. Pancreatic cancer patients are the most malnourished patients in oncology, and they have a complex pathway who involves a lot of healthcare professionals and caregivers during a long period. So to implement this kind of pathway is important to, this is our cancer pathway. So it's important to align efforts across the care team. And this includes assessing local resources. And for this point, it seems essential to rely on nurses to help to all the care team for this intervention. Nurses are the professionals who provide a holistic view of the patient throughout all the care pathway. To the success also of this intervention, it's also important to involve all healthcare professionals and ensure coordination between hospital and community setting. And finally, a systematic nutritional assessment at the same time of physical condition assessment is essential for ensure the success of this intervention and the adaptation of this intervention to the patient condition. And the program evaluation is essential. Also, we should routinely gather feedback from both patient and caregivers and be ready to adapt intervention and our program when challenge arise. So in conclusion, physical activity is a high impact intervention that can significantly improve quality of life and outcomes for pancreatic cancer patients, whether they are undergoing chemotherapy or preparing themselves for surgery. Nurse, as a healthcare provider, play a crucial role in assessing, educating, and supporting patients through these programs. Integrate physical activity and nutritional support into our holistic care plans. We not only treat the disease, we also empower patient or persons finally. So thank you all for your attention,